So Essential Skills Training offers an awesome course for clinical skills. In that course, we're looking at basically things that can mirror a condition of clients. So we're looking at testing urine, because urine can tell you so much about your overall health. You're looking at taking temperature, pulse, respiration. We're looking at measuring blood glucose levels. And that can be life or death as well. So what we're looking at in that day is not just learning the skill, but we're learning how to interpret the results. Like anyone can learn to test urine or take a blood pressure, but what we want you to take back to your workplace is, what does this result mean? What does a high blood pressure mean? What constitutes a urine infection? A true urine infection? What constitutes someone who's 84 years old and isn't really showing signs of illness but has a raging temperature? So things how we can look at not just the skill but how we can apply it in the workplace, how we can interact and learn from each other and learn some basic industry terminology as well. So while we say clinical skills, the act of doing these things is a skill. But during the day, we're going to have loads of fun. We're going to learn different scenarios. You'll come up with your own little client who you can apply these illnesses or symptoms to, and you can work out maybe what's going on with them. Apart from customer satisfaction, apart from an awesome reputation, I think it's important that organisations understand that having staff, having skill bases that can identify issues is also mapped to the standards of care, like the accreditation standards. Standard 2, for example, we've got a lot of clinical indicators like skincare, pain, identifying pain, sleep, and all of these other clinical issues come into play. So it does reflect an excellence in the ability to meet those standards and to meet the rights and responsibilities of the residents' charter as well.